When disaster strikes, whether it's a raging wildfire, a devastating oil spill, or a tragic human accident, wildlife often bear the silent brunt of the damage. Their natural habitats are obliterated, and many animals are left with catastrophic injuries, none more harrowing than severe burns. This is where a specialized group of heroes steps in: wildlife veterinarians and dedicated rescue teams. Their mission is not just to save lives, but to navigate a complex medical journey from the very brink of death to a hopeful return to the wild. It begins with the urgent call to action, often in chaotic and dangerous environments, to locate and secure those most in need. The immediate aftermath of a fire or accident is a race against time. Rescuers, often volunteers working alongside veterinary staff, must first locate injured animals, which can be disoriented, frightened, and prone to hiding. Once found, a rapid field triage is essential. This quick assessment determines the severity of their injuries, their chances of survival, and the urgency of their transport. Safe capture techniques are paramount to prevent further injury to both the animal and the rescuers. It's a delicate balance of speed, compassion, and practical medical assessment in often treacherous conditions, identifying which lives can be saved and prioritizing those with the greatest need. Once triaged, injured wildlife requires swift and careful transport to a specialized veterinary facility or rehabilitation center. This stage is critical for stabilizing the animal before intensive treatment can begin. Animals often suffer from shock, hypothermia or hyperthermia, and immense pain. Transport vehicles are equipped to provide immediate supportive care, including oxygen, intravenous fluids, and pain medication, to ensure the animal arrives in the best possible condition. The journey, sometimes long and arduous, is more than just a ride, it's a continuation of emergency medicine, where every moment counts towards increasing the animal's chances of survival and recovery. Upon arrival at the clinic, the animal undergoes a thorough clinical assessment. This involves a detailed physical examination, evaluating the extent and depth of burns, checking for smoke inhalation injuries, trauma, and secondary complications. Veterinarians categorize burns from superficial first degree to full thickness third or fourth degree, which dictates the immediate treatment plan. Blood tests are performed to assess hydration levels, organ function, and potential infections. This comprehensive evaluation is foundational, providing the medical team with the crucial information needed to tailor a precise and effective treatment strategy for each unique patient. Severely burned animals experience excruciating pain. The immediate priority after assessment is aggressive pain management to alleviate suffering and minimize stress, which can hinder recovery. Potent analgesics, often administered intravenously, are used to keep the animal comfortable. Simultaneously, stabilization efforts focus on addressing shock, maintaining body temperature, and restoring fluid balance. This often includes intravenous fluid therapy, oxygen supplementation for smoke inhalation victims, and keeping the animal in a warm, quiet, and sterile environment. These initial interventions are critical not just for comfort, but to prevent the body from shutting down due to the immense physiological stress of severe burns. Burn injuries cause significant fluid loss through damaged skin, leading to severe dehydration and electrolyte imbalances, which can quickly become life-threatening. Fluid therapy is a cornerstone of emergency burn treatment. Intravenous fluids, carefully calculated based on the animal's weight, burn severity, and physiological state, replenish lost electrolytes and maintain blood pressure. This vital intervention helps to prevent organ failure and supports the circulatory system, delivering essential nutrients and oxygen to tissues. It's a continuous, monitored process, ensuring the animal's internal environment remains stable enough to support the arduous healing journey ahead. Once the animal is stabilized, attention turns to the burns themselves. The first step in wound management is meticulous cleaning and debridement, the removal of dead or damaged tissue. This is often a painful process requiring sedation or anesthesia. Necrotic tissue harbors bacteria and prevents healthy tissue regeneration. Gentle but thorough cleaning with sterile solutions removes debris and prepares the wound bed for healing. Debridement is crucial for reducing infection risk and promoting granulation tissue formation, which is the foundation for new skin growth. This delicate procedure is repeated regularly as part of the ongoing wound care. Burned skin is a compromised barrier, leaving animals highly susceptible to secondary bacterial and fungal infections. Infection can rapidly spread, leading to sepsis and further tissue damage, potentially fatal outcomes. Strict infection control protocols are paramount. This includes maintaining a sterile environment, using antiseptic solutions during wound care, and administering broad-spectrum antibiotics, often based on culture and sensitivity testing, to combat existing or potential infections. Regular monitoring for signs of infection, such as fever or changes in wound appearance, is crucial to adjust treatment promptly and keep these resilient patients on the path to recovery. Advanced burn dressings play a vital role in protecting wounds, promoting healing, and managing pain. These aren't just simple bandages, they are often multi-layered, medicated, and designed for specific purposes. Silver sulfadiazine cream is a common choice, providing antimicrobial protection. Manuka honey dressings are also frequently used for their antibacterial and anti-inflammatory properties, promoting moist wound healing. Hydrogels keep wounds moist, while specialized non-adherent dressings prevent further tissue damage during changes. Regular, often daily, dressing changes are performed with utmost care, transforming painful, open wounds into healthier, granulated tissue ready for regeneration. Healing from severe burns requires an immense amount of energy and nutrients. Burned animals have significantly increased metabolic rates, demanding more calories and protein to repair damaged tissues and fight infection. Aggressive nutritional support is therefore critical. This may involve force-feeding specialized diets, or in severe cases, intravenous feeding. The diet is carefully formulated to be high in protein, vitamins, and minerals essential for wound healing and immune function. Ensuring adequate nutrition not only fuels recovery but also helps prevent muscle wasting and strengthens the animal's overall resilience throughout the demanding rehabilitation process. For extensive or full-thickness burns where natural healing is insufficient, skin grafting may be necessary. This advanced surgical procedure involves transplanting healthy skin from another part of the animal's body, or sometimes using synthetic grafts, to cover the damaged area. The goal is to provide a protective barrier, prevent infection, and promote faster healing. Skin grafts are complex and delicate procedures, particularly in wildlife, requiring meticulous surgical technique and postoperative care to ensure successful integration and minimize rejection. This reconstructive step is often a major turning point in the recovery of severely burned patients, allowing larger wounds to finally close. Once wounds begin to close, the focus shifts to restoring mobility and preventing complications like contractures, where scar tissue tightens and restricts movement. Physical therapy is crucial for burned wildlife, just as it is for humans. This can involve gentle range of motion exercises, massage, hydrotherapy, and assisted walking to strengthen muscles and improve joint flexibility. Tailored exercises help animals regain the agility and coordination vital for survival in the wild. The veterinary team works patiently, encouraging movement and preventing long-term physical impairments, ensuring the animal can eventually run, jump, climb, or fly as nature intended. Beyond the physical wounds, severely burned wildlife often suffer significant psychological trauma. The experience of fire, capture, pain, and prolonged human interaction can cause immense stress, fear, and behavioral changes. Rehabilitation specialists work to minimize this trauma by creating quiet, secure enclosures, reducing human contact where possible, and using enrichment activities to stimulate natural behaviors. Observing an animal's behavior is critical to assess their readiness for release. Animals must not only be physically healed but also psychologically resilient and capable of coping with the stressors of their natural environment, free from learned fear of humans. The recovery process for severely burned wildlife is rarely swift. It can stretch over weeks, months, or even a year, requiring unwavering dedication from veterinary staff. Throughout this period, animals are continuously monitored for wound healing progress, signs of infection, nutritional status, and behavioral changes. Regular examinations, blood tests, and adjustments to medication or therapy are common. This extended care ensures that every aspect of the animal's health is meticulously managed, addressing any setbacks promptly and guiding them steadily towards full recovery. The commitment to long-term care is a testament to the profound patience and compassion of these animal caretakers. Treating burns in wildlife presents unique challenges not typically encountered with domestic animals. Each species has distinct physiological responses to injury, different skin structures, and varied needs for wound care. For instance, a bird's delicate skin and feathers require different bandaging techniques than a koala's thick fur and sensitive paws. Rehabilitation plans must also account for species-specific behaviors, diets, and natural instincts. A deer needs to regain running speed, while a squirrel needs climbing ability. This necessitates a deep understanding of ethology and zoology, tailoring treatment to ensure the animal can thrive in its specific ecological niche. Despite the best efforts and advanced medical care, not all burned animals can be saved or fully rehabilitated. Wildlife veterinarians often face the agonizing decision of euthanasia. This difficult choice is made when an animal's injuries are too severe, their pain is insurmountable, or their chances of returning to a meaningful wildlife are non-existent. It's a compassionate act to prevent prolonged suffering, a recognition that a wild animal's quality of life is intrinsically tied to its ability to live naturally. These decisions, though heartbreaking, are an ethical part of wildlife medicine, prioritizing the animal's welfare above all else. The ultimate goal for every rescued and rehabilitated wild animal is a successful return to its natural habitat. Preparing for release is a carefully planned process. It involves a final comprehensive veterinary checkup to ensure all physical wounds are fully healed, and the animal is in peak health. Behavioral assessments confirm the animal retains its wild instincts, foraging skills, and fear of humans. Often, animals are moved to pre-release enclosures, larger and more naturalistic, to acclimate them to outdoor conditions and reduce their reliance on human interaction. This stage is about rewilding, ensuring they have every tool necessary to survive independently. The moment of release is the culmination of months of intensive care, dedication, and hope. It's a powerful and often emotional event, as the animal, once clinging to life, steps back into the wild, a testament to its resilience and the tireless efforts of its human caregivers. Teams choose release sites carefully, considering habitat suitability, food availability, and the presence of other wild populations. The reintroduction is often monitored, sometimes with tracking devices, to ensure successful reacclimation. It is in these moments, watching a once broken creature reclaim its freedom, that the true impact and profound success of wildlife veterinary medicine are most vividly felt. While treating burned wildlife is heroic, preventing these tragedies remains the ultimate goal. Conservation efforts, responsible land management, and public awareness campaigns about fire safety and mitigating human-wildlife conflicts are vital. Investing in early warning systems for wildfires, promoting sustainable development, and reducing pollution all contribute to a healthier environment where such incidents are less frequent. The dedication of wildlife veterinarians reminds us of our responsibility to protect the planet's diverse creatures. Their work not only saves individual lives but also inspires a greater commitment to conservation, hoping to build a future where fewer animals suffer preventable harm. From the smoky chaos of a disaster zone to the quiet dignity of a rehabilitation clinic, the journey of severely burned wildlife is one of immense struggle and profound recovery. Behind every success story stands a team of veterinarians, technicians, and volunteers whose expertise, resilience, and unwavering compassion make these miracles possible. Their work is a demanding blend of cutting-edge medicine, deep biological understanding, and an unshakable belief in the value of every life. These are the unsung heroes who mend the broken, heal the burned, and fight tirelessly to give our wild neighbors a second chance, embodying the very best of humanity's commitment to the natural world.